This is Dr. Theodore Henderson with Neuroluminance Brain Health Centers, talking to you today about ADHD. Now, ADHD, we see the kid running around the grocery store and that's ADHD, they really need to medicate that kid. But it's a lot more complicated than that. And one of the things that's happening in psychiatry is that we're evolving in the way we think about ADHD. And it's based on the science. It's based on the science from SPECT brain scans and from functional MRI, but also from clinical experience. Think about this for a second. We're told that depression is all about not enough serotonin. But in my book, Brighter Days Ahead, I talk about the fact that the science showing that serotonin is responsible for depression has been disproven. There is no relationship between serotonin and depression. Science is evolving. Now in ADHD, we have to pay attention to the fact that this is a huge problem. 4.3 million children in America alone have ADHD. Another 8 million adults have the diagnosis of ADHD. And what's the treatment? Well, every morning you get up and you take a stimulant medication, and it lasts 6 to 8 hours. And so your brain functions for 6 to 8 hours, and then it sort of stops. So the mornings and the evenings are awful. And who wants to be giving their kid a stimulant medication every day? Show me one parent who says, oh yeah, that sounds like a really good idea. It just doesn't happen. So one of the things that is true about ADHD is that it is about frontal lobe dysfunction. The frontal lobe circuits that activate dopamine, that activate attention and focus and concentration go offline when effort is evoked, when somebody tries to concentrate. So what we're doing with multi-watt infrared light therapy, LUMID therapy, here at Neuroluminance Brain Health Centers is we're treating the frontal lobe. And we're seeing some pretty amazing results. So you're going to meet here a patient who came to get treated for long COVID. His long COVID got better, but a funny thing, so does his ADHD. A lifetime of taking Vyvanse, past 18 months, he's not needed Vyvanse at all. A lasting solution to ADHD. And that's exciting. So stay tuned, we'll have more on that. This is Dr. Henderson signing off.